Thank you very much. Hello, everybody. I want to compliment Trisha for a lovely presentation this morning. I wish all of you could do that, and I wish I could also do that. It was excellent. Now, my name is Akil Taher. I am a practicing physician in the US for the last 40 plus years. I am a Mumbai boy. I did my schooling in St. Xavier's at Dhobi Talao, and I did my medicine internist this thing from Nagpur Medical School, and then I'm practicing over here in Atlanta, Georgia, for the last so many years. I will be 73 this month, so you can wish me a happy birthday in advance. Okay, now, having said that, I'm going to talk to you about...
Hello, can't hear.
Can't you hear also? It's very clear on my side.
Very clear on my side too. Very clear.
Yeah, it is very clear.
For those who cannot hear, please log on, please. I'm going to be muting everybody so you can all hear the doctor.
Can't hear anything.
Yes, doctor, continue.
Okay, so what I'm going to talk to you today is about heart disease, heart attacks. Remember one thing, heart disease is the leading cause of death worldwide. It is more common than all the cancers combined. Not that I'm belittling cancer. Cancer is also very important, and people have made strides how to do that, and we have time when somebody gets cancer. With the heart disease, if you get a heart attack, 50% of the people die with the first heart attack. Now, having said that, we as Indians or South Asians from Bangladesh or from, say, Nepal, or as far as Bhutan and all those places, Sri Lanka, we are 25% of the world's population. 25% of the world's population, but we carry 60% of the world's heart disease. Something wrong over here, terribly wrong. And this is what I'm going to tell you. I see a lot of y'all over here, all are women, but even I want you to take this message to your husbands, to your brothers, to your sons, because this is extremely important. Why is it that we as Indians die? And not only die, but are dying at a younger age. So with that, what I'm going to do is, I'm going to start my slide presentation. Everybody can hear me, right? So I'm going to share my screen. Give me a moment. Okay, here we are. So everybody can see me,
Yes,
right?
doctor.
Good. I'm just trying to get this. Okay. So we have already talked about it. We are 25% of the world's population carrying 60% of the world's coronary artery disease. And we are also likely to get heart disease at a younger age. 25% die of heart disease before the age of 40, and 50% die before the age of 60. And just recently, the American Heart Association has come up that more women are now dying of heart disease than men. Before it was not so. Before we are missing out women because they have slightly vague symptoms, which we can talk about in the questions and answers when we come to that. So let me tell you that just recently, I found this gentleman, an Indian from Broomfield. He's from Colorado. He was a mountaineer. So in the Denver area around here in Colorado, we used to climb mountains and he used to get a little short of breath. 53-year-old. And he used to say, maybe I'm getting older. Till he was walking at the airport, got severe shortness of breath, chest pain, fell on the ground, taken over to the emergency room, had to have bypass surgery and received 7 stents. This is us. He's 53 years old. We are not realizing this, but it is extremely important. So I want you to understand this is my story. I'm wearing 2 hats. My first hat that I'm wearing is of a physician. I see a lot of South Asians in my practice, Indians and other countries in South Asia. And I wear another hat because I am a survivor of heart disease. Let me tell you my story. I have a very strong genetics of heart disease, high blood pressure, kidney problems, high cholesterol. So with that, and my lifestyle was terrible. And I'm not ashamed to say that. I loved rich, oily, greasy foods. I used to be a seafood eater, SEE. Whatever I saw, I ate. I used to eat, I used to, like we say here in America, I used to pig out. I used to eat so much and all bad food. I had a type A personality. And I also did not exercise at all. I was a couch potato. I only exercised my eye muscles to look at other people exercising in the park. So, with a type A personality, with a bad diet, with no exercise, and trying to live the American dream, I had a very stressful life. So what happened to me? At a very young age, at the age of 56 years old, I had coronary artery disease. I was in London. I was walking over there. I got the chest pain. I flew back to US. The doctors found I had blockages. They put stents in me. And then what happened? After putting the stents, the next 5 years were the worst years of my life, from 56 to 61. I did not want to accept this. I continued my same lifestyle that I was having before. I was severely depressed. My wife had to carry me to a psychiatrist. I'm a physician. I was doing well with my patients, but my personal life was a disaster. Bronchitis, sinus infections visited me every year. I started having gastroesophageal reflux disease. I got perforations in my colon. They wanted to cut me open. I had inguinal hernias, thrombotic piles, chronic constipation. I had every imaginable problem that people can have. So it was a standing joke था हमारी क्लिनिक में कि कोई भी आता था और पूछता था कि भाई मुझे तो ये है सिम्टम्स, तो मैं उसको यही बता रहा था कि अरे घबराओ मत, मुझे भी यही है प्रॉब्लम. समझे कि नहीं कि मेरी हालत इतनी खराब थी. तो क्या हुआ? The stents were there, the stents failed. And at the age of 61, I had to have open heart bypass surgery. और जब मुझे लेके जा रहे थे सर्जरी रूम में, something happened to me. I was tired of living this life. I had two choices. कि सर्जरी के बाद rocking chair पे चला जाओ, start living vicariously through my children and pass away my life. Or let this setback जो हुआ है to become a comeback. कि maybe I can improve my life and do something about it. I chose the letter. तो मैंने उनको नर्सेस को आईसीयू में ऐसे ही एनेस्थीसिया जब दे रहे थे, मैंने बोला कि इन 1 year's टाइम, 1 साल में अगर सब कुछ अच्छा रहा तो I will go ahead and do a half marathon. That is about 23 kilometers. तो अच्छा बाईपास सर्जरी हो गया, but now I had changed my attitude. I wanted to live. I wanted to not just survive, I wanted to thrive. So मेरा जो ये था, this thing, after the surgery, it is extremely painful. Don't get me wrong. But मुझे अब change हुआ था, so I started feeling pleasure in the pain because I changed my life. From that moment onwards, there was no stopping. I started exercising properly. I started meditating. I started yoga, and I started eating right. Diet is more important than exercise. You cannot outrun your diet. So, before I come to the Asians or Indians and why we are dying, so many of us are dying, let me explain to you all that what are the vessels that give blood to the heart. ये जो बोलते हैं ना कि ट्रिपल वेसल ब्लॉकेज हो गया, 3 आर्टरी ब्लॉकेज हो गया, 4 आर्टरी ब्लॉकेज हो गया, 5 आर्टरी ब्लॉकेज. सो दिस इज एन आर्टरी. और ये जो है ये ल्यूमेन है. दिस ल्यूमेन का जो है where blood flows properly in this. ये जो endothelial cells है यहाँ पे, this produces a very important substance, nitric oxide, which keeps this coronary artery dilated, protects the walls, and sees that there is no plaque formation. See how smooth it is? Because it is very important, this endothelial cells should not be damaged. अब देखो कि what do we eat? A rich, unhealthy diet, the standard American diet, is rightly called the sad diet. And why is it called a sad diet? It is full of junk. Dairy, eggs, meat, carbonated sugary drinks. And folks, you are having a bad diet. I am having a bad diet here in America. You guys also are having a bad diet in India. Look at an Indian diet. We have got a cultural connection with oil, carbs, saturated fats, sugar, ghee, butter. And so what happens to that free flow of blood that was in the vessel that I showed you before? What happens to that? Now you start getting this damaged. This is the damage to that endothelial cells, so that fat starts depositing over here and keeps on depositing till it comes so narrow, it becomes that you start getting, it reduces the blood flow and you start getting chest pain, which we doctors call as angina. This takes years, decades to form. this atherosclerosis. It starts at a very young age. That is why I want you to tell your children or your brothers or sisters that please, this plaque formation is because of the damage to the endothelial cells because of the food we eat. Now, these are the lucky ones who get the angina. They can get treated. But what happens to the other part? Now, this is the recent studies that have been done, that a heart attack is sometimes when these blockages or clots hote hai, they suddenly break and goes into a certain part of the heart, stops the blood flow instantly, and you get a heart attack. Folks, 50% die with the first heart attack. No time to say goodbyes. No time to take care of your affairs. They just die. 53-year-old, I showed you that gentleman in Colorado, 56 years here sitting in front of you. And now the ages are getting less and less. When I started my practice in America, I never saw somebody having a heart disease or cholesterol or diabetes before the age of 50. Now I'm seeing people at 35 years. Americans, white Americans, Black Americans, South Asians, Indians. And remember, folks, we are 4 times more likely to get heart disease than other ethnic groups, like Chinese or Vietnamese or all that. We were lumped together in America with the Asians. But now they've just passed a bill that we should be considered separately because we have a higher incidence of heart problems than the other ethnic groups. So what happens when you get a heart attack? It's an emergency. So you're taken, 911 is called, you're taken to the emergency room, they do the EKG, they do the blood work, they find out that you are having a heart attack, they take you to the cath lab, your boom, 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 your clots are removed, and you have to get the stents in, and if that fails, you have to have bypass surgery. What does the bypass surgery do? Now, one thing, both my partners here in the US, both had heart attacks. And they did not have 90% blockages. These were 50% blockages. But their clots were not firm, like I showed you in the previous one with angina, which takes years to form. These are soft clots. They broke open. One had to have stents and other had to have surgery. And both my partners are physicians. So the 3 of us, we make a trial. I had angina, they had heart attacks. So let me go to the next slide. So what happened to me? I had plaques which were thick, containing calcium, unlikely to break. 2 of my arteries were 98 to 99% blocked, but I did not get a heart attack. I was lucky. Now imagine when you're not getting a heart attack, what do doctors do? Let me explain to you one thing and get this as a take-home message. 50% of the stents and bypass surgeries done in US are unnecessary. And I think the percentage is same or even higher in India. So when you have angina, talk to your doctor. Is there any other means that you can do besides opening me up? And we'll come to that. So when you have a plaque that we were talking about, the first picture when I had angina, it takes decades to form this plaque. Okay, you see this artery over here. If you have this narrow arteries, what happens is Here is the blockage. But in the other picture, you find that there are collaterals. Collaterals meaning that these collaterals come over here so that the blockage may be still there, but the heart is still getting a certain amount of blood. Your heart is never devoid of complete stoppage of blood. Let's take an analogy. If you have a stream of water, a raging stream, आपको उसको बंद करना है, तो you take stones or bricks and start coming from the bank and coming in the center, and you'll stop the stream. No. The water will find its own way under the stones, above the stones, sideways to go forward. Similarly, we form these new blood vessels as we age, so that the blood can go over to the heart with these collaterals, new blood vessels that is shown in the figure, and can still give you the blood flow to the heart. This is extremely important to understand, because that is why when younger people get a heart attack, they do not have this collaterals formation. So they tend to die of a heart attack. While in the case of older people, they survive because they've got new blood vessel formation. Now, I have attended this conference. The world is Dr. Esselstyn. What he said was that in the auditorium, they showed us a video of a 71-year-old. He had multiple problems and he had these blockages. He had so many problems that he was not a candidate for heart surgery or stents. So what they did was, they showed us a video. He could not walk from one end to the other end of the room. And this was his artery, moth-eaten, narrowed down over here, the coronary artery. So what they did was, they put him on a whole food, plant-based, no oil diet. Within 3 years, no stents, no heart surgery. This is what his coronary looks like. So folks, what is my message? Is food, food. Food is medicine. And this was done. So if I had an opportunity, if I had known now what I know then and understood, I would not have had the heart surgery because I had angina. I would have gone for this. Because basically I destroyed my endothelium. I'm doing good right now with my diet and I'm a vegan. But still, you should always ask your doctor. Heart attack, different. You need the stents, you need the heart surgery, sure. But when you have angina, talk to your doctor, talk to your cardiologist. Okay, so what are we doing? We doctors are great at treating the consequence of the disease. Once you get heart disease, we are experts. Or you do this and you do surgery, you want a heart transplant, we can do it. You want a liver transplant, we can do it. We're experts at treating the consequence of the disease. But nobody talks about the cause. Now we start talking primary cause. Reduce your cholesterol, reduce your sugar, you will not get diabetes, you will not get heart disease. But I go a step further. This is primary prevention. Talk about the primordial prevention. Primordial prevention is what? Primordial prevention is कि ये चीज होना ही नहीं चाहिए. ये high cholesterol होना ही नहीं चाहिए. ये sugar होना ही नहीं चाहिए. And that is where we should be doing, is changing our diet. 600% increase in vegan diet in America in the last 3 years. So we are definitely living longer. but we are not living healthier. What I want is, with the whole food, you live longer and you are healthier. So what we are doing is, if you look at this sink, overflowing sink, we are mopping the floor, we keep on mopping the floor. All you have to do is turn the faucet off. And that is where your primordial prevention is. I guess I've not bored you, but now we come to a very important subject, heart disease in South Asians or Indians. Let's take Indians. It's the same thing. Why do we have? We still don't have all the answers. We are still studying and we are writing the book. But let me explain a few things that we have discovered in the last few years. The general risk factors of getting a heart disease, the leading cause of death in the world, is high cholesterol, blood pressure, smoking, diabetes. This is the Interheart study that they found. But what we in America did was a masala study. A masala study is a mediators of atherosclerosis in South Asians living in America. What they found is that even though we Indians are not obese, not fat in the true sense of the word, we carry fat. We carry fat in our bellies. We carry fat in our abdomen. This fat in the abdomen is directly related to heart disease. अब कभी Indians को देखना, when you're walking around, of course not in the COVID time, but when you're walking around, you'll find Indians not really obese. So when doctors say, "Bhaiya, you are not fat, it is okay, you can go." No, you are. What you are carrying is you are carrying that little pouch. Take for me, for example, when at 56 years, when I was diagnosed with heart disease, what was my this thing, BMI, जो बोलते हैं ना कि कितना weight और height में क्या हो, was perfect. So the doctors, the cardiologists say, "Oh, it's okay, don't worry about it." But I had a pouch. I had an abdomen. That is where my fat was. This fat is there in your liver, around your heart, in your muscles. This fat is deposited over there. So what they say is do the waist circumference for South Asians. Don't go by the BMI. Not more than, it should not be more than 35 inches in men and not more than 30 inches in women. The lesser, the better. Because ye yaad rakhna, abdominal fat, visceral fat is directly related to heart disease. Number two, we are diabetic जो होते हैं, we are insulin resistant. इसका मतलब क्या हुआ? ये साथी study, दूसरी study है. This also was done in a very big study in America. What they found is, it was done in Indians. Insulin resistance क्या होता है? कि sugar जब blood में आता है, तो insulin comes in to take it to the muscles to be used as energy. When this insulin takes it to the muscles and the muscles are blocked by fat, which we discussed before, it cannot be used as energy. It comes back into the blood and your blood sugar rises. Simple. And if this rises, you get pre-diabetic, diabetes at a much, much earlier age than other ethnic groups. Why we have this insulin resistance? We are studying, but we don't know yet. But the idea is that it is partly because of the food we eat. Also, Indians have smaller coronaries. The arteries, heart ko deti hai blood, well, they are smaller. And therefore, they're more likely to get blocked. So we not only have smaller coronaries, but our lesions, जो plaques होते हैं, They are big lesions. And we have multiple vessel disease. एक दो vessel नहीं होता है, 4-5 vessels blockage हो जाते हैं. This is us Indians. Again, जो है cholesterol, triglycerides, ask your doctor. You should know more about your health than the doctor should know. So if your triglycerides are high, that should be up to 150 around here, but I don't know the Indian this thing right now. But I was practicing and I've seen people, it should be up to 150 triglycerides. I've seen people with 1,000, 5,000, and 10,000. Look at this. This is what the blood looks like when you take out, not a microscopic. When you draw the blood, it is creamy sauce. And Indians tend to have high triglycerides. And combination with low good cholesterol. जो गुड कोलेस्ट्रॉल होता है ना, जो HDL बोलते हैं, वो गुड कोलेस्ट्रॉल गार्बेज ट्रक होती है. तो गुड कोलेस्ट्रॉल, what it does is it takes away all the bad cholesterol from the blood. So if your good cholesterol should be high, 50, 60, 70, ऐसा होना चाहिए. लेकिन गुड कोलेस्ट्रॉल अगर लो हो और ट्राइग्लिसराइड्स हाई हो तो प्रॉब्लम पड़ता है. So this is very common in Indian, high triglycerides, low good cholesterol. तो ये चीज जो है लोग I have got some 10 patients, Americans, who have a very high cholesterol. जो इनका cholesterol, 9 are women and 1 is a man. Their cholesterols are in the 90s. I kid with them. I joke with them that you will probably die of a common cold, but you won't die of a heart disease. You have very low good cholesterol. My good cholesterol when I had my heart disease, anybody wants to take a guess? It was only 29. Now with exercise, eating right, I have raised it up to 57. It can be done. It can be done at any age. To live longer and healthier, it can be done at any age. We Indians carry calcium into our arteries. Why? We don't know. So somebody is there and has got a very strong history, family history of heart disease from his genetic history, but has no other high cholesterol or anything and wants to know, okay, so he or she can get a coronary calcium content. ये होता है. तो ये अगर calcium ज्यादा हो, the doctor बता सकता है. I'm not going to go into details right now, but that is a harbinger of heart attacks and strokes. Calcium को भी, if you are not having any problems and you want to know and you've got a bad heart disease in the family, then get your coronary calcium done. Okay, so the next is the risk factors continuing. So we have a higher metabolic syndrome. We talked about that. We have spilling. We spill more protein in the urine. Why? We don't know. But the inflammation is a very important part. Apni arteries ko inflame zyada hota hai in Indians. Then again, this is very common in Indians. We have more gestational diabetes. Our women who get pregnant tend to be more diabetic than other races. And then once the pregnancy is over, once the delivery is over, they tend to become type 2 diabetes. We have a very sedentary lifestyle. Especially I can talk about my age group in America. We didn't know how to spell the word exercise. we were all couch potatoes. Please, if you give me excuses that arthritis, my joints are hurting, I can't walk, I can't do that, please don't give me that excuse, because that is not going to kill you. Do the exercises that was showed to you by Trisha this morning. Do it every day. Go for a walk, go to nature. That will really, really help you. But if you sit and do nothing, it's going to be a problem. And the most important thing is dietary habits. What is a South Asian diet? Refined, processed foods. See, here we don't use trans fats, but trans fats is used in India. Your white rice, flours, saturated fats, oil, ghee, butter, sugary snacks, laddus, rasmalais. Now, see, understand this in America, especially, and now in India too. एक तो bad Indian diet है. On top of it, if you merge it with the Western diet of meat, eggs, dairies, pizza, sweetened beverages, disaster, time bomb. और यही होता है अमेरिका में कि second generation Indians are very active. They exercise a lot. They're not very fat. But when they come home and eat their mother's food, oily food, they tend to become diabetic. We have a cultural connection with oil. Because what we do is if we have a pot of curry and if the oil is not floating on the top, we feel we are not doing justice to our guests. We feel that oil is a sign of warmth. And we also reuse oil. If you reuse oil, then this becomes cancerous at high heat. So please, folks, people will tell you, oh, coconut oil is good, oh, palm oil is good, this oil is good. I am not asking you to stop using oil. Spray it. Don't let it be soggy with oil. We tend to do that. We fry our foods. So I've given you a basic idea of why Indians have this propensity of getting heart problems more than the others. So what can we do? We love to talk about our son getting into medical school, getting into law school, being a CFO, CEO of this company and that company. We never talk about our health. We never talk about how our son and brothers and sisters are dying of heart attacks. Talk with your family. Find out what is going on. How can you prevent it? It's extremely important. Beware of your risk at an earlier age. I'm 73. I have a grandson who is just turned 9. He's here in the US. Plaques, atherosclerosis, those things which I showed you initially, start at the age of 8. So change the habits of the younger people so that they don't die at 40 and 41. Just the other day, I was called in my neighbors because they were crying over on the phone and they said, can you please come over here? And I saw that 32-year-old son lying on the floor. We did the CPR, we did everything, we called the 911. He died. The postmortem was what? 32-year-old coronary artery disease. He had a heart attack. Talk to a doctor who knows the risk factors of us Indians, especially in America, and discuss that. If you have somebody in your family who has got a problem and has got angina, ask, discuss, read, talk to people, and get a coronary calcium or a heart scan done if you have to. Now, what can we do about it? Eat a heart-healthy diet. Trust me, I've been a vegan for the last 10 years. I am enjoying thoroughly the foods. You know, complex carbs, we have the brown rice, we have the sweet potatoes, we have the vegetables. I play a game with my patient. I say from A to Z, or you all call it Z, from A to Z, how many vegetables can you name? And then there are grains, beans, there are 22 varieties of beans, lentils, fruits. Even if you're a diabetic, you can have fruits, sweet, mangoes, bananas. It is okay because it has got the fiber. So there is a slow rise of sugar. While the process, your sugars, imagine. I'm a Gujarati. I know when we have tea in the morning, we put 3 or 4 teaspoons full of sugar. Look at labels, my dear, dear friends. Look at labels. Avoid junk vegetarian food. Junk vegetarian food is worse than eating meats. Now, if you look at a label and you cannot pronounce it, don't eat it. Simple. Cut back. I'm not asking, even if you're a non-vegetarian, cut back on your meats and your saturated fats. Ideally, you should be a vegetarian. But then you will ask me, India is 80% vegetarian. Why so many heart disease? Junk food vegetarians. Exercise, my friends, exercise. If you're older, what she told you this morning, do that. You can get up then your eyes open in the bed, you can start exercising. You can take your ankles towards your body, take it away, rotate your ankles, even before you get up. Try to do simple things like tying your shoelaces without going on the floor, and try to balance. It is not only strength, but balance is very important at an older age. Strength training, balance, heart aerobic exercises. Now, remember, it is not bad genes that run in the family. It is a bad diet that runs in the family. ये सब बोल देते हैं कि अरे मेरा तो जीन्स ऐसा ही है, मुझे तो जाना ही है ऊपर. Wrong. और अदरवाइज से अरे मेरा जीन्स तो बहुत अच्छा है, मुझे तो कुछ होने ही नहीं वाला है. No, wrong. Genes play only 15 to 20% in your heart disease, or not in any disease. Only 15 to 20%. And if you eat right and do a few important things, you can mitigate this. You can avoid the genetic part of it. Trust me, I'm full of genetic history. Today, I am thriving. Now, if you're younger, then you should be exercising a lot more. Your heart rate, maximum heart rate, is basically when you do your maximum heart rate, you should be exercising 5 times a week, at least for half an hour a day. On your maximum heart rate is 220 minus your age. People who are interested now in this, I'm going a little bit into it, but who want to exercise and raise their good cholesterol. So if you take my age, I'm 73, 220 minus 73 will be about 148. That should give you 70% of that should be about 108. So when I'm exercising and running or jogging, my heart rate should go up to 108. But even if you don't do that and just exercise, it increases your endorphins and your good cholesterol. So you should be exercising. Every doctor in the universe should write a prescription of exercise 5 to 6 times a week, and should be done half an hour at least in a stress-free environment. Just the other day, about a few months back, a couple, American couple, came to me and said they were both diabetics, both in their late 50s, and they had high cholesterol. So I said, why don't you exercise? And I gave them a prescription of exercise, and they came back in 3 months, and the wife looks at me straight, squarely in my eyes, and tells me, that was the worst advice you gave us, doc. And मैं तो हैरान हो गया कि I told you to exercise and you are telling me I'll give you the worst exercise. She said, all we did was walk. When we walked, we fought. We fought going and we fought coming. So there was no stress free. तो स्ट्रेस फ्री होना चाहिए. मैं जब यंगर था और मैं हॉस्पिटल में काम कर रहा था, so I used to go up and down. I would never take an elevator. But was that exercise? Not really, because my mind was full of things. What is the next patient, this patient, that patient? What do I have to do? Take a breather. Go out in the open, in the park. Not now, but later on when things get better. And start exercise in the open. I had a wonderful experience when I went to the Anhata ashram in Mysore, where I spent just with bare minimums. It was such a great experience. And finally, everybody has stress. It is not stress that kills you. It is how you handle stress. Agar stress kisi ko kills you, then all the top guys, the presidents and prime ministers of the world would be dead. They know how to handle stress. Some people are born, they can handle stress better. Some people like me need crutches. So use meditation, spirituality, religion, yoga. I've been to Mount Kailash. I went on a yatra. I went on foot. I've done the Umrah when I was in Mecca. I've done both these things. Immense peace. That is meditation. That is yoga. That is the time you feel what are the material things in life? Nothing. With that, let's just look at this. This is a packaged thing in America. Enriched flour. It is bleached with chlorine and enriched with vitamins to extend shelf life. Natural flavor mixed with chemicals to enhance flavor of your processed food. Artificial color made from petroleum, also found in jet fuel. भाई देखो, packaged foods को देखो. And then 33% of Americans eat shelf food. Okay, now we go, look at this. Doesn't your mouth water? Does your mouth water if you're a non-vegetarian when you look at a goat or a chicken walking on the street? This is what we should be eating. This is where you drool, your saliva, whatever it is, broccoli, pomegranate, beans of sorts, and avocado, and bok choy, and superb, almonds. Okay, so now I come to the end, and I would like to take questions, but before that, please remember, my book has come out. It is called Open Heart. It is available. There are a lot of heart healthy and other aspects, insights in that book. So please try. It is available on Kindle. And if you don't have Kindle, you can download the Kindle app. And it is not available in paperback. So it is called Open Heart. And all the proceeds of this book, sale of this book, are going to charity. So I am only one thing I have in mind right now, folks, is to save the people from getting heart disease, men, women, all over the world. It is the leading cause. Even with the COVID situation, it is still the leading cause. When you talk about COVID, what do they say? Simple steps. What are the simple steps? Wash your hands, wear a mask, don't be around, keep a safe distance, don't get into large gatherings. What is to prevent a heart attack? What is it? eat right, exercise, try to handle stress, and have a close-knit family, and you are not going to get your heart. Simple things for a complex problem. But if you don't, in the COVID situation, you do things, you can land up on a ventilator. In the heart disease, if you don't do the simple things, you can land up like me. Learn from my mistakes. That is what the book is about. So please, if you can, I would appreciate it. Also go on my website. It is Akil akiltaher.com. Very simple, akiltaher.com. AKILT as in Tom, AHER.com. And go on my site, see the various things. If anybody has
Between
problem.
Akil and Taher. There is a dot between Akil and Taher.
No. That is my email address, Adarsh. That is akil.taher48@gmail.com. If anybody has any problems or wants questions, you can even email me. I'll be very happy to help you. And
I have sent everybody the email, his email ID as well as his website on the flyer page. Just have a look.
Yep. Okay. Now I'm ready for any questions. If I don't have the answers, I will look it up and answer you, but let me answer most of your questions.
I have a question. Does the heart rate mean the same as pulse?
Yes. Unless you have got an arrhythmia problem, heart rate and pulse is the same. If
be 220 minus, like for example, I'm 71. So what should be my pulse rate or heart HR?
You see, when we said about 220 was the exercise, 70% of the heart rate. The heart rate is
okay.
It is for the exercise. Otherwise, your heart rate should be within 70 to 80s. That is perfect. When you do that exercise, it should be 70% of your heart rate, of your maximum heart rate.
I have a question.
Yeah. Did you answer your question, others?
Yes, I have a question. I have a question, doctor.
Mm-hmm.
The thing is that since you have said, and very correctly, that the heart disease process can start very early in the age without the person realizing it. Then in that case, is it advisable that from 30 or 40 or whatever you suggest for the South Asians, they should have an annual cardiac checkup plus the lipid profile, what you should, triglycerides and cholesterol, good and bad cholesterol, so that they keep in check, they keep in contact with the cardiologist and he advises them for a smoother life ahead?
Very good question. Excellent. Who is it? Name, please. Srila, right?
Yeah, actually, it's my daughter's name, Suhasini.
Suhasini, that was an excellent question. I do believe because heart disease is getting a younger age group, I think it is fair enough that if you've got a very strong strong family history, you don't necessarily need to go to your cardiologist. If you have a good internist or a family physician, get your chemistry profile, your cholesterol, your good cholesterol, your bad cholesterol, your triglycerides done every year. If they tell you that, no, you need angiography and you need stress test, no.
Yeah.
We are not there. Just get your cholesterol. If you find that your cholesterol is high, then you can act upon it.
Correct.
If you find your triglycerides are high, you can act upon it. But very important thing that you mentioned is, yes, at a younger age, because we are getting heart disease at a younger age.
Correct.
So you're right. You should get it done. And we even tend to do it if it's a very strong family history, grandmother, grandfather, father, mother, uncle, then we even do it in the pediatric age group.
Yeah. Okay.
Okay, go ahead.
I actually have one more question, considering the time.
Oh, I'm sorry. I did not look up the chat, so I don't know what the questions are. But we are running out of time, Saleh.
I think we can take one more question, or if you have anything else to share, maybe a last question. But you know what, Dr. Akil, one thing what you could do, what I don't think that you've actually done enough of, is tell them what you did after your bypass. How many marathons, how many triathlons, how many mountains, and how many other stuff that only makes me jealous of what you've done. I think that shows what you can do if you put your mind to it at any age.
You know, I can tell you this much. Your mind can take your body to places that you never thought of. Your mind can take your body to places. Trust me. After that 7 months, 8 months, the nurses told me, have you done your half a marathon? So I did my half a marathon. It was tremendous in the sense the feeling that you got after finishing it. Then I went next year. This was in 2010. On 2011, I went, somebody said, do you want to come to Yatra, to Mount Kailash? Actually, I thought it was trekking. So I went trekking, but then it was a Yatra. So I said, no, I came for trekking and all that. And the Chinese would, because they're in Tibet, they would not let me go. So I said, okay, if I can't leave and I'm in a group of people, they're nice people, let me join them. So I did all the Havans and prayers and all that. And believe me, I'm not kidding you. When I came home after a month, my wife says there is a change in you. I did Mount Kailash, 19,000 feet. Then in 2012, I ran my first full marathon, 43 kilometers in Chicago. After that, I ran the Boston Marathon. After that, I did the Standard Chartered Mumbai Marathon.
Oh,
And I did the Standard Chart Mumbai, but I collect money for charity. I collected 10 lakhs of rupees in the Mumbai Chartered Marathon for St. Jude's and PETA.
Very good.
Yeah. And then I was in American Heart Association. When I ran the Chicago, I collected $10,000. And that was also for the American Heart Association. And there are several people who got the heart surgeries in Mumbai because of the collection of the 10 lakhs too. So that is what I did. And then I said that, look, I'm running and I'm exercising, but I'm still not getting that. Initially, I was not a vegan, but I'm still needing, every time I ran a marathon, I would have to have 10 days of lying down. So I said, there must be something wrong. What am I doing wrong? Then it dawned on me, my diet. So instead of having a piece of chicken and all that after this thing, I started having just vegetarian, whole food, plant-based. So when I did a 100-mile bike race, it was, my God, it was so cold. It was extremely cold, gusty winds, crosswinds. It took me 9 hours to do the 100 miles. And I was on a vegan diet. So as my trainer and I were going back to my small town, which was about 3 hours drive, I get a call from my clinic that we don't have a doctor tomorrow. And I turned around and said, don't worry about it, I'll come. So 9 hours of biking, sitting in the car, going 3 hours driving, going back. Next day, I do a 10-hour shift of work. No problems. So then I started doing triathlons. Triathlons, I had to learn the road bike at my age. But I took my son's bike, I learned how to do it, and I did a triathlon in my age group in America with the Americans. I stood third. So that was a big thing for me, you know. Now, I am not asking you, and then last time, my fear is gone. If you do not fear death, then you are not fearful of living. Think about it. Once you overcome the fear of losing your life, then you're not fearful of living your life to the fullest.
Yeah.
So you have to understand, I'm not asking people to climb mountains. Mount Kilimanjaro in Tanzania was the most difficult feat that I've ever done. It was 50% oxygen on top. There was no bitter cold, minus 20. And we were there. I'd taken my grandson's the feeder, and my trainer's sliver of her wedding dress. So I had to, and I could not even find it. It was so cold, but you get that high. Anything you want to do. I'm not asking you climb mountains, run marathons. No, I'm not asking you. But you have to be active. You have to be active in mind, body, and soul.
Yeah.
And I have a lot of skeletons in my closet. I am not speaking from a pedestal. Please. I have a lot of problems, but I'm solving it. I'm living now. So I tell people I'm not 73. I'm only 13 years old. So that's when I started living, last 10 to 12 years. You don't make the same mistake. Your children should not make the same mistakes. Your relatives should not make the same mistakes, and start living at a younger age. So this is what I have done, 100-mile bike race, this, that. And my last thing now is to actually swim with the friendly sharks in Hawaii. So I'm waiting for the COVID to get over, Oh, by the way, I'm sorry. Can I take two more minutes, please? Very important. Saleh, can I take 2 more minutes?
Yes, doctor.
Okay. Very important thing. If you are a vegetarian, please, you must take vitamin B12 as a supplement. You must take. Because the idea is that previously our vegetables, in the soil, there were bacteria that made vitamin B12. Now with all the insecticides and pesticides, your bacteria are dead. They're not making the B12. So if you are a pure vegetarian, I've seen a lot of my vegetarian patients all low in vitamin B12. Number 2, even more important, in the COVID era, if you cannot go out and cannot get the sunshine vitamin, that is vitamin D. If you can't get the sunshine vitamin, don't sit at your window and get the sunlight coming. That is not, the rays will not give you the vitamin D coming through the window pane. You should be out in the open to get the ultraviolet rays, vitamin D. So in my opinion, even before the COVID, 60% of the nursing home patients in America, 60% are vitamin D deficient. So you should take a supplement of vitamin D. You should take a supplement of vitamin D, period. There is not only one case I've seen of toxicity in my 45 years of practice. There is no toxicity. Take about 2,000 international units of vitamin D a day, because a recent study showed that vitamin D even protects you from COVID. There was a small study done, but it was a double-blinded study. It was of 50 people who had COVID-19 serious enough to be admitted in the hospital. Okay, so these 50 people were admitted to the hospital. 25% of those people were given high doses of vitamin D. Of course, this was a study. So they were given 50,000 units. And the other.
Doctor, can we take 60,000 vitamin D once a month?
No.
We get those capsules.
No, I'll explain to you. You see, you have to take vitamin D3, not D2. Not the cholecalciferol, not the cholecalciferol. You have to take the ergocalciferol, the vitamin D3.
Yes, sir.
Vitamin D3 is now available. First, it was fish oil in the fish but now it is available vegetarian also, vitamin D3. Now, what you should do is you should take a daily dose, because the one which you take the 50, daily dose, especially in the COVID period. And take it with your biggest meal. Vitamin B12 on empty stomach, vitamin D on a full stomach. Got it? Now, I was telling you about the study. So 25% of them got high doses of vitamin D. The 25% did not get. The people who got high doses did not get the vitamin D. Out of those 25 people, 8 of them got onto the ventilator. But people who got the vitamin D, only 1 went to the ventilator. COVID-19. So please take your vitamin D. Supplement, not orange juice and milk and all that. That is not having enough vitamin D. It's international units. And I personally feel that nobody should have milk, but that's another story.
Thank you very much, doctor. This has been, it is very interesting to see that you could keep 40 people quiet for 1.5 hours. Amazing, because people tend to actually, like that. I think this is amazing. Thank you very much, doctor. Everybody, I've put this on. I'm going to put this entire recording onto our website. Please feel free to listen to it again. Again, one more time. Thank you very much, doctor, and we shall see you again soon.
We appreciate you coming
Thank
on
you
so
so
much,
much.
doctor.
Thank you, doctor. I really enjoyed your lecture.
We wish you a good, healthy life ahead.
Thank you.
Thank you very much, doctor.
I wish you all the best in life.
Thank you.
And I love you all.
Thank you so
Thank you,
much.
doctor. Thank you. Thank you very much. Very nice.
Please read my book. It is going to charity, so please read my book. Thank you. And write reviews. It may be good, bad, ugly, whatever you think, but write reviews on Amazon. Okay? Take care. Bye-bye.
Guys, bye-bye.
Happy birthday to you. Happy birthday.